We have the example of COVID, pandemic. During COVID pandemic, there was a huge need of, diagnostic tests. And so far as I see the experience of Punjab, we collaborated with every possible diagnostic facility available in Punjab for the purpose of doing as many possible PCR tests as we could. And that was the time that my own lab that was meant for hepatitis C and B PCRs was totally devoted towards COVID testing, and it was blessing in disguise that I had the most modern equipment. So that was 6800 available, only one equipment in the public sector of Punjab, and we did almost 2,500 PCR tests per day in those days, and that was the commitment. And that is a pretty example, a beautiful example, that in any area of diagnostics, whether for hepatitis, whether for HIV/AIDS, or other human papilloma virus and other diagnostics, we can collaborate not only with the public sector entities available elsewhere, but also with the private sector people. And that is the requirement of healthcare ecosystem at the moment. Networking and productive networking with a positive approach and engaging everybody for the the patient center, for the centered care. We need to collaborate with each other, and that should be the commitment of everybody out there. And without that commitment, without that collaboration, government instead alone is not really in position to deal with such huge burden of disease in any disease area, whether from virology, even you can talk of tuberculosis, you can talk of even non-communicable diseases, even you can talk of maternal and newborn health. Every area needs collaboration, strong commitment, and commitment should be at all level. Commitment means the commitment of the government, governmental commitment, political will, and harnessing the political will to develop a culture of healthy healthcare ecosystem is a must nowadays. And to me, as a public health person, the collaboration with private providers, with international experts. Now, as we know, diseases have no boundaries at the moment, and we have to interact with every person whosoever can be helpful to deliver the patient-centered services to evolve the culture of healthcare ecosystem in Pakistan as well. And that's my submission, that such efforts to involve all the experts of the field, whether from IT, whether from microbiology, virology, clinicians, and the managers, and the government functionaries and the policy makers, decision makers, all they have to be networked under one umbrella for the purpose of provision of standardized and uniform sort of services for humanity.